Bell's palsy. Introduction. Bell's palsy is an acute, unilateral facial nerve paralysis of sudden onset, commonly attributed to viral infections. It results in temporary weakness or paralysis of facial muscles, affecting expressions, blinking, and speech. Although self-limiting in most cases, prompt treatment can enhance recovery and reduce complications. Definitions. National Institute of Neurological Disorders and Stroke, NINDS. Bell's palsy is a condition that causes sudden, temporary weakness or paralysis of the muscles on one side of the face. World Health Organization, WHO. A rapid onset neurological disorder affecting the facial nerve, leading to unilateral facial paralysis with no apparent cause. Risk factors. Infectious and neurological factors. Reactivation of herpes simplex virus, HSV1, affecting the facial nerve. Other viral infections, example Epstein-Barr virus, varicella-zoster virus. Autoimmune reactions causing nerve inflammation. Lifestyle and environmental factors. Diabetes mellitus, increased susceptibility to nerve inflammation. Pregnancy, particularly in the third trimester. Exposure to cold temperatures and sudden temperature changes. Etiology. Viral infections, dormant herpes simplex virus, HSV1, in the geniculate ganglion can reactivate, causing inflammation and disrupting facial nerve function, leading to Bell's palsy. Ischemic neuropathy, poor blood circulation due to microvascular disease can deprive the facial nerve of oxygen and nutrients, resulting in nerve damage and weakness. Autoimmune mechanisms, the immune system may mistakenly attack the facial nerve, causing swelling and compression, which interferes with normal nerve signaling and muscle movement. Types. Types of Bell's palsy, based on etiology. Idiopathic Bell's palsy. Most common type with no identifiable cause. Thought to be linked to viral infections or autoimmune reactions. Herpetic Bell's palsy, Ramsay-Hunt syndrome. Caused by reactivation of varicella-zoster virus. Often accompanied by ear pain, vesicular rash, and severe facial weakness. Atypical Bell's palsy. Presence with prolonged symptoms, incomplete recovery, or unusual progression. May require further investigation to rule out tumors or neurological disorders. Types of Bell's palsy, based on characteristics. Unilateral Bell's palsy. Sudden, temporary paralysis or weakness of one side of the face due to inflammation of the facial nerve, cranial nerve 7. It is the most common form of facial nerve paralysis and typically resolves within weeks to months. Bilateral Bell's palsy. Affects both sides of the face, though very rare. Can be linked to Lyme disease, Guillain-Barré syndrome, or sarcoidosis. Recurrent Bell's palsy. Multiple episodes of facial paralysis over a lifetime. May be associated with underlying conditions like diabetes or autoimmune disorders. Types of Bell's palsy, based on severity. Mild Bell's palsy. Partial facial weakness with slight asymmetry. Minimal difficulty in closing the eye or smiling. Moderate Bell's palsy. Noticeable facial drooping and weakness. Some difficulty with eye closure, speech, and eating. Severe Bell's palsy. Complete paralysis of one side of the face. Inability to close the eye, smile, or move facial muscles. Pathophysiology. Viral reactivation or autoimmune-mediated inflammation, HSV1, varicella-zoster, autoimmune response. Down arrow. Facial nerve edema and compression within the narrow fallopian canal. Down arrow. Reduced blood supply leading to ischemic damage of the nerve. Down arrow. Demyelination and impaired neural signal transmission. Down arrow. Unilateral facial paralysis, weakness, and loss of function. Down arrow. Gradual nerve regeneration and functional recovery, weeks to months. Clinical manifestations. Sudden onset of unilateral facial weakness or paralysis. Inability to close the eye or smile on the affected side. Loss of taste sensation in the anterior 2/3 of the tongue. Increased sensitivity to sound, hyperacusis, in the affected ear. Drooling due to impaired lip control. Dry eye due to reduced tear production. Diagnostic evaluation. History taking, the doctor asks about the onset, progression, and possible triggers of facial weakness to identify the cause. They also check for associated symptoms like ear pain, rashes, or prior infections. Physical examination, facial muscles are assessed for weakness, asymmetry, and coordination, along with cranial nerve function, to determine the extent of nerve involvement. Electromyography, EMG. This test measures electrical activity in facial muscles, helping to determine nerve damage severity and predict recovery potential. Magnetic resonance imaging, MRI. MRI scans the brain and facial nerve to rule out serious conditions like tumors, strokes, or multiple sclerosis that might mimic Bell's palsy. Blood tests. Blood work helps identify underlying conditions such as diabetes, Lyme disease, or autoimmune disorders, which could contribute to facial nerve dysfunction. Medical management. Corticosteroids. Prednisolone is prescribed to decrease nerve inflammation, reduce swelling, and improve facial muscle recovery. Early treatment within 72 hours of symptom onset enhances the chances of full recovery. Antiviral therapy. If a viral infection like herpes simplex or varicella zoster is suspected, medications such as acyclovir or valacyclovir may be given to stop viral replication and aid in faster healing. Artificial tears. Since Bell's palsy can cause incomplete eye closure, artificial tears keep the eye lubricated, preventing dryness, irritation, and potential corneal damage. Pain management. Over-the-counter or prescription analgesics, including NSAIDs, help relieve facial pain and discomfort associated with nerve inflammation. Physiotherapy. Regular facial exercises help maintain muscle strength, improve coordination, and prevent complications like synkinesis, involuntary muscle movements. Surgical management. Facial nerve decompression, a surgical procedure used in severe cases where nerve compression prevents recovery, aimed at relieving pressure on the facial nerve. It is rarely performed due to its risks and uncertain success rate. Gold weight implantation. A small gold or platinum weight is inserted into the upper eyelid to help patients with persistent eyelid weakness. It assists in eye closure, preventing corneal damage caused by dryness. Nerve grafting. In cases of complete nerve degeneration, a donor nerve, example sural or hypoglossal nerve, is used to restore facial function. This procedure helps regain some facial movement but requires extensive recovery. Dietary management. Soft foods. Consuming mashed, pureed, or soft foods helps reduce strain on facial muscles, making chewing and swallowing easier. Adequate hydration. Drinking sufficient water prevents dehydration, supports nerve function, and promotes overall recovery. Vitamin B12, essential for nerve regeneration. B12-rich foods like eggs, dairy, and fish aid in repairing damaged facial nerves. Omega-3 fatty acids, found in fish, nuts, and seeds, these helps reduce inflammation and promote nerve healing. Avoid spicy and acidic foods, these can irritate the nerves and cause discomfort, especially in cases of facial sensitivity. Limit caffeine and alcohol, these substances may contribute to dehydration and nerve irritation, potentially slowing recovery. Small, frequent meals. Eating smaller portions throughout the day prevents fatigue while chewing and ensures adequate nutrition intake. Use a straw if needed. For those experiencing severe facial weakness, using a straw can help with easier fluid intake without spillage. Nursing management. 1. Acute pain related to facial nerve inflammation and muscle weakness. Interventions. Assess pain level, location, and characteristics to determine severity and appropriate management. Administer prescribed analgesics or NSAIDs for pain relief. Apply warm compresses to the affected side to promote muscle relaxation and comfort. Encourage gentle facial massages and relaxation techniques to reduce muscle tension. 2. Impaired facial mobility related to facial nerve dysfunction. Interventions. Encourage facial exercises to maintain muscle tone and prevent stiffness. Educate the patient on mirror therapy to help retrain facial muscles. Use assistive devices, example eye patches or tape, to protect the eye and prevent complications. Provide emotional support to boost confidence and reduce self-consciousness. 3. Risk for corneal injury related to incomplete eye closure, logophthalmus. Interventions. Administer artificial tears or lubricating eye drops to prevent dryness. Apply an eye patch or tape the eyelid shut during sleep to protect the cornea. Instruct the patient to wear sunglasses outdoors to prevent irritation and dryness. Educate the patient on proper eye hygiene to avoid infections. 4. Imbalanced nutrition, less than body requirements related to difficulty chewing and swallowing. Interventions. Provide a soft or liquid diet to facilitate easy chewing and swallowing. Encourage small, frequent meals to maintain adequate calorie intake. Suggest the use of straws for fluid intake if needed. Monitor weight and nutritional status to assess for deficiencies. 5. Disturbed body image related to facial asymmetry and muscle weakness. Interventions. Encourage the patient to express feelings and provide emotional support. Educate the patient on the temporary nature of Bell's palsy and the recovery process. Offer counseling or support groups to help cope with self-image concerns. Reinforce facial exercises and therapies to improve recovery outcomes. Prevention. Maintain a strong immune system, eat a balanced diet, exercise regularly, and get enough sleep to prevent viral infections. Protect against cold exposure, wear warm clothing and avoid sudden temperature changes, which may trigger nerve inflammation. Manage stress. Practice relaxation techniques like yoga and meditation to reduce stress-related immune suppression. Control underlying conditions, keep diabetes, hypertension, and other chronic illnesses well managed to reduce nerve damage risk. Practice good hygiene, wash hands frequently and avoid close contact with people who have viral infections to prevent herpes simplex virus reactivation. Complications. Permanent facial weakness or asymmetry. Corneal ulcers due to incomplete eye closure. Synkinesis, involuntary muscle movements during voluntary actions. Psychological distress and social withdrawal. Conclusion. Bell's palsy is a temporary but distressing condition causing facial paralysis due to facial nerve dysfunction. While most cases recover completely with prompt treatment, supportive care, physical therapy, and emotional support play crucial roles in improving outcomes and reducing complications.